I am Dr. Sharjeel and you are watching my YouTube channel. After a long time, I am presenting a video with a sound, and today one of my students asked me a very good question, that what's the difference between artery and vein occlusion, and why the retina is pale in the artery occlusion and it is full of hemorrhages in the vein occlusion. So I have shown you four different funduses you can see, and you can definitely diagnose it, like here superior branch retinal vein occlusion, because there are hemorrhages and exudates in the occluded area. And then in the second patient, you can see hemorrhages all over the fundus. That's a central retinal vein occlusion. And when there is a paler or whitish retina devoid of any blood in a quadrant, that is branch retinal artery occlusion. And when the whole fundus is pale and there is a cherry red spot, that is central retinal artery occlusion. So why there are hemorrhages in the venous occlusion and why the retina is pale in the arterial occlusion? So it's a very simple thing that we all know, that the blood is coming to the retina through arteries. When the arteries are blocked, no more blood comes towards the fundus, and the veins are functioning and they drain all the remaining blood from the retina. So there is no blood at all at the retina, and the retina is pale white, and the cherry red spot is due to the choroidal circulation, which is intact. Like here you can see the inferior branch retinal artery occlusion. Now there is no blood in that area. Now why there were hemorrhages in the venous occlusion? Now, as we have already told you, that the blood comes through arteries on the fundus, on the retina. So the blood is coming, but it is not going out of the fundus. So blood is pooling, and then there is extravasation of that blood from those veins and other exudates, and that's why we get hemorrhages all in the occluded area or in a central retinal vein occlusion on the whole fundus, because there is a lot of blood coming in and there is a pooling, there is no way out. So there is a blood in the venous occlusion, and you can see in this patient of a central retinal artery occlusion that the fundus is devoid of blood, because there is no blood coming into the retina and veins have drained all the blood from the retina. So if you think you will get the answer that why in arterial occlusion we have a pale fundus and why in a venous occlusion we have got hemorrhages, exudates, and tomato ketchup like picture. So I hope after watching this short video, at least you will get a concept of retinal vein occlusion and retinal arterial occlusion, the appearance of the fundus. Thank you very much.